Good afternoon. My name is Michael Dan. I am a social worker at the Spanish Association of the Familial Mediterranean Fever and Autoinflammatory Syndromes, STOP-FMF. First of all, we wanted to thank to the organizing committee of the International Autoinflammatory Awareness Month, aim on which is STOP-FMF, together with KAIS ZETA and especially the coordinating entity, the Autoinflammatory Alliance, also to all those present. In our role as an association that represents the patients collective in Spain and that in turn works in network with recognized international entities, today we are going to expose the impact that autoinflammatory syndromes have on daily life. In case there is anyone who doesn't know what autoinflammatory syndromes are, they usually occur in outbreaks and their symptoms are fever and recurrent inflammatory episodes. They cause pain, chronic fatigue, and they also produce organic disability. This is that type of disability that affects internal organs. Our relationship with the environment affects our life in many different ways since we are children. When a disease imposes certain limitations on us, this relationship with the environment and with other people can become more complicated. And this is even more serious if it is a rare disease. It is unknown and therefore misunderstood. In comparison to the past days, numerous and important milestones have been achieved in terms of healthcare, examinations, and medical treatments. However, must be remarked that the person's life can not only be viewed from a clinical point of view. Considering systemic approach, we should take care to all areas of a person's life, including the social area, psychological, educational, and occupational. In the educational system, we face the challenge of promoting an inclusive education that provides a quality training for all and a school a safe space for children with autoinflammatory syndromes. We often meet families of autoinflammatory patients who encounter difficulties in exercising this right. Neither their curricular adaptations are made, nor their needs are taken into account. A direct consequence of this is the high probability of dropping out of school, which has major long-term impact, making to get a patient-friendly job position ever more difficult. Another possible and more desirable risk is bullying or social isolation, especially at school age, not being part of the peer group in activities presenting some kind of difficulty in carrying out activities or of daily living or daily tasks means the possibility of not being accepted by the group and therefore not participating in the community. Low or no participation brings with it deficits in social interaction and in the creation of satisfactory and fulfilling social relationships. All these can have irreversible consequences on the psychosocial development of patients. All these circumstances do not only occur at school age. When patients reach adulthood, this risk may not disappear and may even worsen. The consequence of lack of training due to dropping out of school to access the labor market or desired jobs, or the inability to avoid absence at work that can be caused by outbreaks of the disease can trigger different risk situations in the workplace, from conflicts with colleagues and superiors to the dismissal or burnout. In patients' associations, we know the importance of psychosocial intervention in these situations. It is as or more important and necessary than health treatment. It's also more invisible. For this reason, we work to observe the person as a social being who relates to the environment and to other people in addition to being a patient. From the patients' associations, we offer specialized care to the group of autoinflammatory patients, and we work in the different areas of life. Our aim is to help these people to become empowered in the face of the disease, to teach them tools and resources to coexist with it, and therefore to improve their quality of life. To sum up, it's important that patients and families join organizations in their countries to work together to defend their rights, which are more research, better diagnosis times, better treatments, but also social protection resource, educational and employment assistance, and quality psychosocial care. It has been a pleasure. Thank you very much.